Okay, Vitality, we made it. All right, let's go ask him and see what Matt has to say to answer these questions that I have. Where is he? Oh, he's working hard over there.
Okay, Matt, I have a question. Dr. Firemilk and myself, we work really closely with our members to help them reduce the risk of heart attack, stroke, diabetes, etc. How does the muscle fit into this, or does the muscle even fit into this equation at all?
Probably heard this word inflammation in terms of, inflammation is a big deal. Inflammation can lead to stroke and heart attack and to other problems. Well, believe it or not, it actually does, not entirely so, but it does have a tie to what's happening with the muscles, and how you train those muscles can actually reduce your inflammatory biomarkers.
You stay up to date on all of the muscle health link, and I'm curious on if there's anything new that is out in the literature and that shows the importance of muscle, maybe beyond what we used to say, and that it might help our member patients in understanding the importance of developing their muscle, maintaining their muscle, and not allowing it to degenerate.
More recently, the research has come out to basically suggest that the muscle ought to be looked at not just as something that allows you to be active or allows you to play sports or do athletic things like we may have been taught over the years. Your muscle actually is a vital part to your overall body and its other systems. So a lot of the new research that's come out is starting to talk about the muscle in the human body as its own organ system. And if you think about it that way, as important as any other organ system is, as important as we think of anything else as a vital organ, our heart, our lungs, our digestive system, our nervous system. So if you're gonna take it there, what we realize very quickly is we're talking now, if it's its own organ system, then it's the largest organ system in the body. And I'm so happy about this because I think it helps it make sense for people in the way that it ought to. Because what we've seen is that if you can address what's happening with your muscles as you get older, believe it or not, a lot of things start to fall into place and get better. So if you start thinking about your muscles as an organ system and the largest organ system in the body, then most people have to start thinking, okay, that makes it pretty important. That means I need to be thinking about it just as much as I do about my heart and my lungs, right? And then we can start to get on the same page with why you would want to be investing time into caring for those muscles.
So what are the facts about maintaining, losing, or building muscle?
Back when I first started doing research in this area, the story was, as you get older, you lose muscle mass, period. We were seeing so much more when we do the studies. Yes, we'd see strength improve, and not just a little bit. Average study that we did, there was upwards of a 25 to 30% improvement just inside of about 12 to 16 weeks. But then we were seeing so much more occur with people. That was really what got its hooks into me and why I'm doing this, why we have sarcopenia clinics present day. So that was 20 years ago. And the reason that I got so hooked into this is because everything transformed with people. As they got stronger, as their muscles started to return and their strength started to return, they wouldn't just become more functional, they wouldn't just improve their balance, they seemed like they were getting their life back to a larger degree, psychologically, emotionally, spiritually even. And I'm not overstating this. So we know you can regenerate muscle mass at just about any age, and we've shown with just about anything you have going.
All right, so what type of loss are we talking about here?
This muscle mass that you're losing, and with it, strength at a very alarming rate, up to 30% per decade. So after age 40 or 50. So it needs to be taken very seriously. So it's starting to get that recognition, but the way you reverse it, and one of the best ways you can do it is through what's called progressive resistance exercise or strength training is kind of in short.
Physical activity and movement is really important, and we both have recommended more activity and movement. So why isn't this enough for strength development? Aren't people just when they get 10,000 steps, for example, aren't they doing enough to gain muscle mass?
The general public has been kind of misled, I think unintentionally, by some of the data that's come out. Any kind of movement is going to be good for us, and it can be accumulated over a period of time. Just little bits, little bouts could actually make a big difference. And that is very true, still is true. All the studies basically backed it up. It's a reduction in all-cause mortality. If you just move, any kind of movement accumulated throughout the day, that's where the steps have come from that we all are now paying attention to. Here's the problem with that. None of that data really applies to preserving muscle mass as you get older. But you have to be really careful not to fall into this trap of thinking, oh, if I'm walking and I'm swimming or I'm doing these things that would otherwise be good for every other system of the body, what you need to know is there's kind of a more specific way that you have to train your muscles in order to protect and preserve those fibers and to rebuild them. And it's not the same way we do other types of activity. It actually requires, we have to fatigue those muscle fibers in order to create this cascade response in the body, hormonal and otherwise, where the body gets the message that we need to rebuild, that this person is wanting these muscles to get stronger and healthier. And there's only one way to really do that. And again, I don't want to speak in any sort of deprecating fashion about other forms of physical activity. All forms of movement are healthy and good for our bodies. I'm talking specifically about the muscle and how to deal with this condition, sarcopenia, and how to reverse it and how to rebuild those muscle fibers. The research is very clear. It doesn't just happen in a general way.
In your advanced assessments, besides looking at muscle mass and strength, what other things do you look at, and how do you use those results for the benefit of members or patients?
Yeah, I would say we're as serious about the muscles as other specialists that you see out there are in their specialty area, like the heart or the lungs or digestion. Things. It starts with doing proper testing. So you have to do assessments to figure out what is going on with people, where they're at. Same thing with the muscles. Everyone is aging at a little bit of a different rate. We're all aging, but we're all aging a bit differently. People have different genetics that are associated with this. People are eating differently that affect the rate at which we're losing muscle mass. So we have to get in there and we have to do the right types of tests to begin with to figure out, okay, what's going on with this person? Where are they at in the spectrum of things? From a testing perspective, we're going to look at body composition. So we're going to look directly at what is actually happening with your muscle fibers in your arms and your legs and throughout your body to figure out how much you've lost, exactly where you're at. What is the composition of your muscles? Is it mostly lean tissue, lean muscle tissue, or is it a combination of lean muscle tissue with fat starting to marble around it, which is very common if you're not careful. We're going to look at your strength. One of the best ways to measure where you're at in terms of sarcopenia is to look at strength. Are they just starting to show signs and symptoms of sarcopenia, or are they in a severe category? We're going to look at balance, believe it or not, because balance often gets affected. We think about falls and things like that are very commonly associated with aging. Number one cause of emergency room admissions. But one of the primary reasons is we've lost so much muscle mass and so much strength. And this doesn't happen overnight. What I want to say is this is gradual, so we don't always feel it so much. There are a battery of what are called functional vital signs, and they never get talked about. It's amazing. We talk about other vital signs. We talk about our heart rate and our blood pressure and things like that, but we don't talk about our functional vital signs, which should be in the same conversation as blood pressure and heart rate and all the other normal vital signs we're used to getting when we go see our doctors.
When people first start out strength training or doing progressive resistance, do you find that some people might get hurt if they're doing it on their own before they receive proper education and maybe supervision?
We can actually show you where you're at in terms of risk. We can show you if you're not at risk, or we can show you if you're trending toward a risk position or if you're high risk. The good news is once we get that information, we can very quickly interpret it, and we can put you on, we have protocols that we've developed to combat these things so that you start addressing this safely and effectively, and efficiently, I should say, because the average person, we have got this thing down to less than 1% per week, no more than 30 minutes. It really doesn't take a lot of time. It's something you can, if you have other forms of activity that you enjoy doing, I can almost promise you it's going to make your ability to do those other types of activity easier and more enjoyable probably for you. And so it's just something you can kind of throw in your routine and reap the benefits of. When you come here, we're going to ensure that it's going to always be a very safe, structured environment. We have professionals who know what they're looking for. And so it's really what's important to you. If you prefer to be out there and you want to learn how to train and you want to do it yourself at home or at your rec center or wherever you want to do it, on the beach somewhere, that's fine. You can build strength in any number of places. You just have to train your brain to do it and your nervous system, and you have to learn how to do it safely. Come get your screening done so you know exactly where you're at. And then if you're in a place of risk, then let us show you how to get out of that place of risk. And then whether or not you stay here and come and work with one of our professionals or you go out and do it on your own, it's up to you. Because we hate to see people that are investing time into being active. You're the minority. Most people are not in America, unfortunately. You're the minority. If you're investing time into being active, you ought to be getting very, very good results for it. And we want to make sure that you're getting those results. We want to make sure that you're protected from some of these things that don't need to be associated with your aging experience.
With this collaboration now between Optimal Heart Center and Vitality Health, we're able to offer a lot more benefit to our member patients for the reduced risk of heart attack, stroke, diabetes, and other things. And I am extremely excited about this opportunity, and I know that it's going to help them. What are your final thoughts on this collaboration? How you see things moving forward?
I really believe, and this is not just hyperbole or my own opinion, just been reading the recent research over the last few years, I really believe we're going to see some pretty dramatic improvements in these areas. I really think we're going to see that. And just our relationship, we've worked together for such a long time, and to have the opportunity to be so close to one another for the first time really ever, where we're just literally a short walk away, our offices are, that's just going to be a lot of fun, and I hope it'll come at the value and the benefit of your members.